next gentleman needs no introduction because he spoke to our class last week, and he is also going to introduce our speaker. And Buzz, come on up and take the mic.
Well, Connie is in Kansas City this week, so she asked me to step in, and it really is a pleasure to introduce Dr. Robert Lynch. For those of you who have maybe not been in the class as long, Bob and his spectacular wife, Linda, have been members of this class for roughly 51 years. And we have had the good fortune to have Bob present a number of presentations to them, and every one of them is superbly prepared, well thought out, and important to what's going on in our world. So it is a great, great privilege to present our speaker, Dr. Bob Lynch.
I don't need that. Might turn that one off, yeah. I think I'm turned on, we'll turn that off. Yeah. Whoa, almost wish I'd prepared something. Before I start, a personal note. So I was getting dressed this morning, and I had a black shirt, black pants, black socks, and black shoes. And Linda comes over and sees me and says, "What's with the black outfit?" And I said, well, it's a serious talk, and I thought I ought to look serious. And, well, you can see, here I am. She said, I looked like I was getting ready for a TED Talk or joining the bell choir. So here we are. So, well, nonetheless, so I have a disclaimer about this presentation today. And that disclaimer is, it is a biased presentation. I am biased for science. I am biased for evidence-based medicine. I am biased against misinformation because it's harmful, it's dangerous, and potentially lethal, has been lethal. So that's my disclaimer, is that bias. So kind of to begin as an introduction, medical and health misinformation. I'm getting a signal. Should I quit already, Betty? Oh, it's okay. What do I need to do? Am I bent out of shape now? Okay. Let's see. Nothing worked there. Oh, it's going on. It's going the wrong way. There we go. No, that's a very bad account. Well, I can do it without the slides. I feel sorry for Betsy. Betsy spent a lot of time and work in terms of preparing the slides, which I appreciate. So, okay, that's fine. So nonetheless, medical health misinformation is a critically serious issue, such that the U.S. Surgeon General has declared it a health crisis, as has the World Health Organization declared it an international and worldwide health crisis. Medical and health information was present prior to COVID. Obviously, it became heightened during COVID, but it has continued to escalate after COVID. Medical misinformation dates back to the 4th and 5th century, actually, with the idea that bloodletting was an appropriate form of therapy. And so all it did was make people anemic, and it didn't cure anything. So that's kind of the background of it. The medical information has also, though, gotten heightened by the presence of artificial intelligence, as you might imagine. I mean, artificial intelligence now has the capability to make medical information appear so valid, so authentic, that it becomes very difficult to differentiate between what is truth and what is false, what is a myth. And so we're going to get into that here in a little bit. It may be, can you all come back tomorrow and we'll have the slides ready? So basically, for a definition, medical information is information that is false, information that is inaccurate, not accurate, or misleading compared to the best available science at that point in time. Obviously, facts can change as new information becomes available, but based on facts at that point in time, any information that's inaccurate is misinformation. It goes against medical evidence. It can lead people to make healthcare decisions that are harmful. It can cause people to avoid treatments that are beneficial, and it can lead to considerable harm and even death. So the worldwide scale of the threat, particularly of artificial intelligence and its role with medical misinformation, there's alarming examples of this throughout healthcare areas, particularly vaccine information or misinformation, fraudulent cancer cures, and risky medical procedures. And the growing number of places that people can go to obtain information is also escalating. It's made it easier for misinformation to spread at never before seen speed and scale, with false information that's continually outpaces factual information, outpaces truthful medical information across all of the digital platforms that there are. And this acceleration is particularly risky in healthcare settings where inaccurate or delayed information can directly impact patient outcomes and decision making. And I've had personal experience with that, and I'm going to allude to that in a little bit. So for now, I just want you to know that this crisis is most acute in healthcare systems where there's low public trust, which is something that's developing throughout the United States, where there's fragmented care delivery or limited access to authoritative medical sources. Patients increasingly turn to online sources for health information. And in these environments, that makes individuals particularly susceptible to easily accessible artificial intelligence-generated misinformation. Research has demonstrated that medical misinformation spreads much faster than factual scientific information does. And this is because of algorithmic augmentation that occurs or amplification that occurs on social media networks or platforms. These platforms prioritize engagement, in other words, attracting as many people as they can versus accuracy. And there is this tendency rather a psychological tendency for sensational or fear-inducing content to achieve broader reach than measured scientific communications do. Obviously, medical information covers a wide range of areas. I'm going to focus on a few of these areas: vaccines, prime fertile ground for misinformation; nutrition, prime fertile ground for misinformation; fad diets. I mean, do you realize there's over 60,000 diet and nutrition books in the United States of America? They can't all be right, for sure. Cancer cures, fertile area, alkaline solution infusions, you name it, promotion of alternative treatments that are ineffective or even harmful in some situations. A couple of examples during COVID, of course, you all may remember this. COVID vaccination shots were to be avoided because obviously they were going to inject microchips in your body. Well, I mean, if you even think about that a minute, how will that even possibly occur? But it got widespread publication and even led people to not receive COVID vaccinations. Another myth that developed and was popularized was that 5G networks were responsible for fueling the COVID epidemic. And there were even demonstrations against and destruction of telecommunication services based on this. Reports that the vaccine itself caused infertility and other side effects and so on and so on. So it was a fertile time for misinformation. Let's see. Betsy? You here? We're back in business? I never got out of business. Okay. So let's catch up here a little bit. Or not. Okay. Do what? So a lot of comments were made during the time of COVID. For instance, quotes, the death tolls were inflated to sow fear, untrue. Physicians were hiding the true cause of and treatment for the disease, and COVID was no different than the flu. By the way, there's only a few cases, and Lysol or hydroxychloroquine are effective treatments. So attractive theories get elevated to facts, which is sort of interesting. And even after being disproved by scientific information, the public either doesn't get the news, pay attention to the news, or believe the news, and the wrong ideas persist. The myths get perpetuated. The misinformation gets perpetuated. And if it's convenient, politicians tend to exploit the misinformation. I'm going to talk about that a little bit further. So we've got some recent examples of healthcare misinformation. We don't have to wait very long. There's some every day. The most recent, of course, is Trump and RFK Jr. stating that acetaminophen is associated or causes autism. Let me explain about that, what the harm of that is. So when they come out, and it's, well, by the way, a real simple answer to that is it's not true. It does not do it. And so think about this. What if you have a granddaughter, 24 years of age, that's in her first trimester of pregnancy, and she has a moderate fever, high fever, or has a headache? What does she do? She might feel guilty if she takes Tylenol or takes acetaminophen. If she doesn't, fever is harmful to the fetus. What do? Or you persist with a headache. According to Trump, you're supposed to not ever take Tylenol, fight like hell not to take Tylenol. And so these are politicians giving medical advice which should never occur. They have no basis to be making that statement. Okay. So here's some areas. Well, this is actually my organization of what this summary is going to be. So we've defined it. We're going to talk about some of the topics, particularly vaccines, Tylenol, and autism. I'm going to mention a little bit about autism because that's the focus of so much attention from RFK Jr. Myths associated with statins, which I dealt with a lot. Supplements, why social media and misinformation is so dangerous. And then give some advice on how to spot it, how to detect it, what trusted sources are, and so on. This is just a typical headline for multiple publications. I must tell you, I read 46 different articles relating to this, and they're all similar to this. Health misinformation is rampant on social media. And that's the definition that I've already given. Here's the areas that we've talked about. And so, why even be aware of this? Why should pay attention to this? Well, there's several reasons. One, it can harm your health. It delays proper care, as I've mentioned, encourages unsafe treatments. It undermines trust between patients and the medical community. It exploits fear. and uncertainty. The environment is particularly ripe when fear and uncertainty is present, i.e. during a pandemic. Well, it wastes money, without a doubt, and it wastes resources and utilization of resources. It divides, it confuses, it creates anxieties about, well, who do you trust? And that's extremely important because trust is declining, without a doubt, in our institutions in the United States and in healthcare. It affects everyone, even smart, educated people, like a couple of you in this class. I may be done. This may be the last one. It undermines public health. Now, we have another deal going on here now. Do you know there are about 400 some odd bills that are being introduced throughout states in the United States, of which 30 states have already approved bills that are disrupting public health, bills that are reducing restrictions on raw milk. Now, raw milk is now a hot topic. Have you all heard about that? Know about that? And so raw milk is dangerous, by the way, and it does not have the promises that are there. It's not more nutritious than pasteurized milk. It does not carry healthy bacteria. It carries very harmful bacteria. There is a subcategory of bacteria, of E. coli bacteria, that causes incredibly serious illnesses. Read reports of 8-year-old children that have been fed raw milk, and they develop what's called a hemolytic uremic syndrome. And what that means is that it causes red blood cells to destroy themselves, and as a consequence of that, kidney failure occurs. So there's descriptions of children that have been placed on dialysis and placed on respirators because of the ingestion of raw milk. And so our state legislatures are in the process of dismantling restrictions on raw milk, making it easier to produce, to sell, to buy. And so that's just a sample of what's occurring. Other unproven remedies or misinformation that's circulating nowadays is that sunscreens cause cancer. They do not. They prevent cancer. There are unproven remedies and miracle cures. Detox, that's a buzzword, detox. But you know what? Your liver detoxifies things. Your kidneys detoxify things. You don't need other medications to do that. So, unfortunately, probably during the pandemic, thousands of deaths occurred because of taking unproven medications, hydroxychloroquine and ivermectin, you may recall as names from the past. A lot of discussion about research into that. Perhaps there was some benefit to hydroxychloroquine early in the course of COVID-19. I mentioned another myth, another misinformation that is that apple cider vinegar? No. That didn't work. Helps people achieve dramatic weight loss. Well, it was originally actually published in the British Medical Journal of Nutrition and Prevention and Health. It was retracted. It was a flawed study. The magnitude of weight loss was similar to that you get with Ozempic or Wegovy. And it was questioned as why it was ever published in the first place. And this is why I bring all this up. One of the supporters was Dr. Oz. And Dr. Oz, as you know, is now in charge of Medicare and Medicaid services. Not saying all things are bad, but I'm just saying that's sort of the mindset that leads to those kinds of things. Well, we've talked about autism and Tylenol. Is there truth or not? There's a lot of statements from researchers, from scientists that have, this has been studied for several years, by the way. This isn't something that just cropped up. Scientists have been studying this for several years, and there's never, ever been proven any connection, cause and effect of acetaminophen and autism. There are some observational studies that say, well, there's some association, but those studies are very limited, and that association was very weak. So we'll sort of put that one to rest, I think. So autism. Oops, going the wrong way. Oh, let's see. How do I get back? That's, oh, there I go. So one other thing about autism, and this slide shows how there has clearly been an increase in the incidence of autism. And this is what's triggered Kennedy and his group to pay attention to this and try to find the cause for it. The reality is the majority of this increase is because of changes in the diagnostic criteria. They have been expanded to include a lot more symptoms than they did in the past. The age range has also been expanded. And so that's the predominant reason why we see this increased incidence of autism. Research has also shown that genetics play a big role. They're in the process of identifying specific genes. In fact, they've identified one gene if it's present in mother and she takes an anti-seizure medication, let's say she has seizures, called Depakote, those two things create the potential for a child to be born with autism. So genetics, change in diagnosis, probably the real reason why the incidence has increased. It's interesting, this is the incidence compared to different states. So as you can see, at the top is California, at the bottom is Texas, and so you think, well, if there was a single cause like a vaccine or acetaminophen, why would you have this kind of a chart? So sort of interesting. Well, at least it's interesting to me. So here's something of interest, statins. And so statins were first tested, the first report came out called the 4S study in 1994. And there have been innumerable studies since then, innumerable, 10, 12 or more studies, all of which, everyone, shows a reduction in the risk of having a heart attack, a stroke, dying from heart disease, having had bypass surgery, stents, and angioplasties by up to 30%. A 30% reduction, and that's phenomenal when you think about it. And so, unfortunately, several myths have developed regarding statins, which have limited individuals taking statins to some degree. Statins cause severe muscle aches and weakness. Well, they do cause muscle aches. That's clear cut, that's associated. But it's interesting to note that in all of these trials, the incidence of muscle aches was no different in the group that took statins versus the group that took the placebo. There is what's called a nocebo effect. And a nocebo effect is when a person starts taking a medication and already has ingrained a thought that it's going to cause such and such side effect. So even if it causes muscle aches and discomforts, there can be changes in the dose. There can be changes in the type of statin, and there are also non-statin medications that can reduce the risk of having a heart attack or stroke and so on. And so another myth was statins cause dementia. Now, I don't remember about that. Let's see. Oh yeah. Well, there's rigorous studies that have proven even if a statin decreases the LDL, the bad cholesterol, down to 20, there's no evidence of memory loss, cognitive problems, etc. So it's a myth. In fact, statins may be of benefit because there is sometimes in some individuals, there is a vascular basis for dementia, for Alzheimer's. Well, if you're managing that vascular risk, improving that risk, decreasing that risk with a statin, then that's a value. Statins cause diabetes. It is true that In some situations, statins can elevate blood sugar, and ultimately, and diabetes does occur, type 2 diabetes, but that's predominantly in people that already have risk factors, overweight, bad diet, whatever the case may be. And so it's not like it's creating diabetes out of the blue. It's in individuals that are predisposed by it. Well, now we've got one. Statins don't work, and the science behind cholesterol is a total hoax. Well, that's out there. That circulates. Totally false. Okay, supplements. And this is, you think it's been interesting up to now. It's going to get really interesting. So, at least to me. So, before the COVID-19 pandemic, 58% of American adults use vitamins, minerals, botanicals, live microorganisms, or other dietary supplements to prevent or treat various conditions or diseases, including viral infections, memory loss, and heart disease. Many people also sought out supplements to prevent or treat COVID-19, which contributed to American spending about $55 billion in 2020. Well, supplements are not vetted by the FDA. It's just like food. There is no FDA vetting of supplements. Advertising is often deceptive, and it's not like supplements are free of risk. They are not. They are associated with risk that is real. There was a CDC study that estimated about 23,000 emergency room visits occur per year, and more than 2,000 hospitalizations occur per year, which are attributed to adverse effects of dietary supplements. The incidence of liver failure related to dietary supplements has gone up by a factor of 8 between 1994 and 2021. They are not benign. Little is known about which of the 10,000s of supplement products that are available for sale in the United States actually pose the greatest risk to consumers. Thousands of products have been found to not contain what the label says it contains or the amount. For instance, vitamin D supplements have been shown, not all of them, but many have been shown to have less vitamin D than is what's stated on the label. Dangerously, potassium supplements, so many of those have been determined to have a higher amount of potassium than is stated on the label. So it's very difficult to trust what the labels say. So, supplement misinformation, there's multiple ones. I've summarized a few here. Vitamin C prevents or cures cold. It does not prevent or cure cold. It will lessen the symptoms. Herbal medicines or remedies are always safe and natural because they come from plants. They can't cause harm. The reality is some supplements can damage the liver, can damage the kidney function, kidneys. St. John's wort is one that tends to have that as a risk, and also some supplements can interact with other prescription types of medications, which becomes a real serious problem. Blood thinners are among those, birth control. I know you're all concerned about that, but it will interfere with that. So, not benign. Supplements can replace healthy lifestyles. You don't have to be on a diet. You don't have to exercise. You can take a pill or 2 or 3 or 10 a day. Well, the reality is supplements cannot undo the health risks of poor lifestyle choices. Supplements always boost immunity. The claim is that zinc, elderberry, mushroom extracts can guarantee a stronger immune system. They cannot. Some can give a modest benefit, but none reliably boost immunity. And by the way, an overactive immune system is not a good thing. An overactive immune system causes diseases, autoimmune diseases, inflammatory diseases, and so on. I already mentioned that supplements are not FDA approved. There we go. So here's one. Fish oil prevents heart attacks in everyone. Well, the reality is it does not. Now, one of the things that I do, one of my fears is I'll get up here and say something that has been disproven. I try to keep up with the literature on a daily basis. And so the reality is that fish oil, there was a study that occurred in 2018 called the VITAL study, and it was to evaluate both vitamin D and fish oil in terms of cancer and cardiovascular disease. And it was determined there was no benefit to supplemental vitamin D with reference to preventing cardiovascular disease or preventing cancer. Well, there was recently a subset of that study. There was a group of individuals in that study that actually had low fish intake, like one tilapia a week. And in that subgroup of people, there was actually a 40% reduction in heart attacks by taking omega-3 fatty acids. The only other time omega-3 fatty acids are of value are when an individual has high triglycerides, which are a risk factor for cardiovascular disease, and fish oil can lower triglycerides and therefore lower the risk. Gets us up to date. Detox supplements cleanse the body. Well, I've already talked about that. No evidence that does any value at all whatsoever. Supplements never interact with prescriptions. That's not true. And anti-aging supplements, of which there are now a lot, there are more coming every day. And the claim is that collagen powders, resveratrol, NAD boosters, or quotes, longevity blends make you younger. So I do have an order form if you want that. So the reality is that some can support skin health, joint health, perhaps. But beyond that, there's been no proof, no evidence that these supplements are effective anti-aging agents. That's getting ahead of a lot, so don't pay attention to this for now. Question is, why is misinformation appealing to so many people? Tom Nichols is the author of an incredible book called The Death of Expertise. It's the campaign against established knowledge and why it matters. It's talking a lot about the appeal of misinformation during COVID. And this is quotes from this book, says that entire societies gravitate toward outlandish theories when collectively subjected to a terrible national experience. Conspiracies are deeply attractive to people who have had a hard time making sense of what's occurring, making sense of a complicated world, and who have no patience for less dramatic explanations. Such theories, conspiracy ideas, myths, and so on, appeal to a strong sense of narcissism, interestingly. Conspiracy theories are also a way for people to kind of give context and meaning to events that frighten them. In such a world where a loved one's incurable disease is not a natural event, they tend to attribute it to malfeasance by government agencies or healthcare agencies or so on. So it's an interesting discussion about why this is so appealing to so many. I want to comment a little bit about the mRNA vaccines. There's been a lot of discussion about this. This seems to be now a target also of RFK Jr. He is reducing funding to to mRNA vaccines. He's withdrawn contracts that are worth about $500 million for research. mRNA vaccines are not only effective, as was proven during COVID when it caused a 70% reduction in hospitalizations and death, but it's also being researched to evaluate type 1 diabetes mellitus and effectiveness there. It's also being used to research effectiveness of this vaccine for cancer. In fact, there's an early report about its effectiveness in pancreatic cancer. And so there's a misguided thought that, well, it was They didn't prevent infection. Well, they were never designed to prevent infection. They were designed to prevent serious infection, prevent hospitalizations, and prevent death. And RFK wants to go back to using the old type of vaccines, the old inactivated whole virus type of vaccines, which of course are not as effective as the mRNA vaccines. And so that's something to keep an eye on. It's something that has the potential to be very concerning. There's also another individual that I read, Dr. Peter Hotez, who is a very, very, very well-respected scientist. He's a vaccine scientist. He develops vaccines and sends them to countries that can't afford them. A lot of the African countries, he's been a benefactor to them in terms of his vaccines preventing illnesses that occur there. He's a pediatrician. He's a professor. He's a prolific writer. He's written 4 books. And by the way, he has a daughter who has autism. And he states, and it's interesting that he's made statements trying to explain the true, rational, scientifically proven facts relating to COVID, and he became the target of physical threats. Both he and his family had to have security agents and so on. And the truth is, and this is an important thing to keep in mind, misinformation isn't just some random occurrence of emails that they may see or a bunch of statements on X. There is an entire ecosystem of misinformation, disinformation out there. It goes way beyond the healthcare sector. It's an entire political enterprise. It's coming from various sources, from the White House, both prior to Trump and during Trump. It comes from the Health and Human Services Director, as you know, the House Freedom Caucus, the far-right selected senators, and the CPAC conference. There is also what is called the Disinformation Dozen. This is a group of 12 online personalities, researchers from the Center for Countering Digital Hate that has identified this Disinformation Dozen as being responsible for up to 2/3 of all anti-vaccine content that's present on the internet. This group included, of course, RFK Jr., included the founder and chairman of an anti-vaccine group called Dr. Joseph Mercola, who's an osteopathic physician who, by the way, has made several millions of dollars selling alternative products. Kind of interesting. There has been another couple that were members of this group, and they used their misinformation to stoke fear and distress and claim to have sold tens of millions of dollars worth of products. That seems to be a motivation for a lot of the misinformation. I think that the most reliable evidence says that disinformation was no accident, but a tool by elected officials and power-hungry personalities intentionally weaponizing the political and financial gain. There is what's called the Lancet Commission, which evaluated misinformation and COVID and so on, came to a conclusion that an alarming aspect of the public response to COVID-19 has been widespread vaccine hesitancy, which has been encouraged by this coordinated anti-vaccine movement that goes on to today. This movement has been traced to groups that I've identified, been traced to well-organized right-wing groups. This information is real, as you can tell. The pace and volume have skyrocketed. It's escalated, as I mentioned before, both during and after COVID. It's an orchestrated, well-funded campaign, purposely sends wrong and harmful messages in a way that uses the worst of marketing to prey on people and to get them to do things that aren't helpful to their health. So, with that good news, there are 3 ways or means or causes, opportunities, reasons why our world is a perfect breeding ground for misinformation. It is an orchestrated, well-funded campaign, as I mentioned. members of the Disinformation Dozen seed distrust in evidence-based medicine so that they can fill the treatment void with their potions and with their alternative medicines and so on. Not only did I mention, I think, the amount of money that has been spent on supplements, but it's this $100 billion now in 2021, and this is projected to more than triple by 2027. Number two, in terms of why our country, our world is susceptible or is a breeding ground for misinformation, not only is it profitable, but it provides opportunities for bad actors to speed up societal breakdown. And finally, misinformation thrives in digital spaces increasingly because society increasingly depends upon them. The rise of social media makes it harder than ever to escape the influence of misinformation. Between 2018 and 2020, Facebook and X banned over 147 misinformation outfits. So misinformation has been, I think I mentioned earlier, a timeless feature of the United States healthcare system. Bad information, anti-vax movements, disparate ideas in the beginning about HIV, bogus medical cures, conspiracy theories continued to plague the United States. Misconceptions and outright lies have gripped the public consciousness through social media, news stations, and government officials. So, does anybody have any questions about all this up to this point in time? Oh, well, never mind. I don't want to do that. Let's see, Bob, you have a question.
I've been the beneficiary of omega-3 or Leveza for several years versus over-the-counter fish oil. Would you address the differences? Because that's important. Like, I took fish oil for years, didn't affect my triglycerides at all, versus omega-3, a prescription. Can you, because I've had several people ask me over the years, can I take fish oil? Well, there's a difference.
Yeah, you haven't gotten any scales from this, I understand. So, yeah, there is a difference. Up until this study that I mentioned with fish oil and this subgroup of individuals that had a 40% reduction in cardiovascular risk, there'd never ever been any information that said fish oil was of value in reducing risk of cardiovascular disease, as opposed to Leveza. Leveza does have studies that say that. And so I think that's the big difference between the two, is evidence to say that effectively lowering your triglycerides with Leveza is associated with a reduction in cardiovascular outcomes. Okay? Is it an easy one, Mark, or a hard one?
Who else had a question?
I've seen a rise in recent years of a lot of ads for these supplements to improve your brain functioning. When my dad was in the nursing home when he was alive, he always wanted me to get him Prevagen, and I'd say, "No, Daddy, it's fish oil. I mean, it's not proven. And then I've seen also it's proliferation of other ads now. Oh, it improves 5 elements of brain cognition. Another product, and and those can't be proven either, I'm sure.
Yeah.
And so you have comments about that?
Yeah, that's important that you bring that up because I was going to mention that, and I think I forgot to mention that, both in terms of Prevagen, but also in terms of the supplement ginkgo. Well, the ginkgo was evaluated in clinical trials to say, give one group of individuals the ginkgo and another group not the ginkgo, both of which, and then you monitor the outcomes. Is there less cognitive decline or presence of memory issues in the group that takes ginkgo versus a group that did not? The answer is no. Ginkgo has never been proven to have an effect on Alzheimer's, to improve memory, and so on. So what they do is it's still on the market, if you'll notice, and they change the advertising. They just say vague things like creates a healthy brain. They get by with that, even though there's no evidence that it they don't claim now to treat or prevent Alzheimer's. They've changed the marketing, so to speak, even though there's scientific evidence that it doesn't work. And the same thing as with Prevagen. Prevagen had to change their advertising, by the way. I don't know if you noticed that, but they changed their advertising based on the fact there was no data, no evidence to support their claim. Right. Cheerios. Do you think Cheerios really lower your cholesterol? Come on. Okay.
I have a question too. I mean,
Kim. Yes.
your talk, it breaks my heart to hear what you're saying. That my takeaway is, why is this happening? And power and obviously money. And I mean, if there's other things you can say, but hurting people just to get money and power, it's just devastating. So can you speak to that more about, why people are doing this?
Well, I alluded to that some. I think I'll get into that more as well. I think that, and part of that, a correlated to that question is, I'll go back, I don't seem to be beating up on RFK Jr., but I am. I view him as a total dangerous nutcase. And so why wouldn't he, let's say, start another way. Cardiovascular disease kills somewhere between 700,000 and 800,000 people per year. That incidence has declined up until 2019, and then it's gone a straight line. We're no longer improving that. Why wouldn't he want to focus on the number one killer in the United States of America and try to figure out what is it that's causing this, as opposed to worrying about food coloring and acetaminophen causing vaccine? And so I don't know the answer to that, but a big part of the answer is it doesn't benefit him to do that. He either has one, profit motive, or two, he is associated with trial lawyers. And he's played a big role in pretty much he's going to bankrupt what's called a vaccine repayment system for people that truly have adverse side effects of vaccines. Then there has been a mechanism. He is now lowering the bar for that, so anybody with any trivial complaints that's ever had a vaccine can come in and try to get money from it. And the ultimate thing is going to bankrupt the whole system. So that's a long-winded answer to say, I don't know. Beyond that, I don't know the psychology of it. Okay.
This is power. Got the microphone. There's a pretty good example of a drug that came out to improve a problem, A1C, and it had a side impact of weight loss to the point where the weight loss has become the real primary market driver for that particular drug. I guess there's that possibility with other proven drugs that have a proven symptom relief, but may have another one, a side benefit that's not discovered yet. And I just read something I want you to respond to. Just last night about the use of artificial intelligence to look at like about 1,300 proven prescriptions and to search using artificial intelligence their possibility of a side benefit not currently recognized.
Absolutely. A classic example of that is Viagra. I mean, Viagra was first being studied as a blood pressure medicine and anti-hypertensive medication. And they were doing the studies and they noticed guys were coming in pretty happy about it. And that's when they determined it had value as managing evidence. So thanks. It worked real well. I planted that question so that he could. So, all right. So, what's a lot of things to say? Wow. So, what does all this mean going forward? If we seem to have a lack of confidence or concern or disruption in science. What's it mean for the uptake of vaccines in general? Well, if people rejected well-intentioned, proven innovations from vaccine manufacturers and guidance from health agency, what does this mean for healthcare? What does this mean for future pandemics? I will tell you, there is a book out now. It's called Big, and this is written by a very reputable scientist who says there is definitely going to be another pandemic. I mean, we already had a little bit of a scare with H5N1, but it did not, no evidence that that's infected humans yet, but virologists were very concerned about that. And so I think science says that there will be another pandemic occur. And so how are we going to enter into that if we have a lot of this vaccine misinformation and hesitancy and so on? I think it's all extremely dangerous. And I think clearly the course of progress is changing. And my gosh, I mean, when we talk about raw milk, I mean, we're going back to Louis Pasteur when he first came up with it in whatever, 1840 or so on. And now we're going back to that. So that's another concern that physicians have, I know, and about the direction that we're going. So what's the link between social media and health misinformation, and why is it so dangerous? Well, there's instantaneous and viral spread of that information. It enables users to share content almost instantly. It quickly gains traction, spreads rapidly, and reaches a large audience before fact-checking or corrections occur. Research has also shown that false information can spread significantly faster and wider than accurate information. There are what's called echo chambers on the social media algorithms that feed you information based on how you've engaged with social media prior to this. And so the information then is all tailored, knowing what your interests are or anybody's interest in. So this creates echo chambers, or what are called filter bubbles, where users are primarily exposed to information that aligns with their existing beliefs. I mean, that's very hard to not do that. I mean, as I pointed out before, I have a science bias, and this presentation is basically biased in the direction of science. There are algorithms present on social media that are designed to maximize engagement. In other words, keep you engaged with the information on that site. And it often prioritizes content that evokes strong emotions, and regardless of its accuracy. There's an erosion of trust. Misinformation promotes distrust in the motives of science and healthcare professionals and so on. And human sharing. People share information quickly with one another. Anecdotal evidence, that comes up a lot. Anecdotes, well, let's see, my Aunt Jane's second cousin took a combination of honey and Dr. Bob's ginger pills. And by golly, her memory improved after doing that. That's what's called anecdotal information. And by the way, you can purchase Dr. Bob's ginger pills online. So, how to spot medical misinformation? We're getting there. Well, who's the source? You know, you can kind of ask that question and look at the credentials of the source and see, are there credentials or not, and what are those credentials? Are they selling something? You know, in fact, there's a guy out there now that's attempting to live forever and not die. In fact, he was on Netflix, for heaven's sakes. And he goes on, explains what he does, 1,000 vitamins a day and so on and so on. And then at the end of all that, he wants to sell you something. And so you know that that's not true. Well, is it too good to be true? You know, that should raise an antenna that it might be misinformation. Also importantly, is it peer-reviewed? In other words, have other scientists or other physicians reviewed the study and evaluated its validity? So, what can you do? What can you do? Well, first and foremost, be skeptical. And I think we're doing that more and more. Ask questions. If you read, hear, have a friend that tells you about something, ask questions about it. Share information very carefully on social media. be health literate. And I think that's very important. In fact, there's a study that says only 14% of the American public would be considered health literate. And so I think that's probably pretty close to true. And so that's a good way to fight misinformation. Talk to your doctor before starting supplements and or changing your medical treatment. Now that's always somewhat difficult. There's a lot of people in the United States that don't have access to a doctor, and they don't have the capability of finding a doctor to talk to. But nonetheless, for those that can, that's important. Help your family and friends verify, understand claims. So where do you go for trusted sources? Well, as I stated here, there has been an erosion of trust in institutions, but physicians, for the most part, still remain a trusted source, and so we discuss with the doctor. In terms of academic sources, Mayo Clinic, I think, is valid. Cleveland Clinic is valid. Harvard Health Information is valid. I think those are resources or sources to go to try to verify a certain claim. Peer-reviewed journals, PubMed is pretty good. I think it's reliably honest. Health News Review. So those are some sources. So we'll summarize here and see a few more questions. Medical misinformation as well as anti-science. And by the way, anti-science has now becoming a broad-based issue to define what's occurring in the United States these days. Anyway, it's a serious and urgent issue, as you can tell, with major health consequences. The convergence of AI has exacerbated the problem, without a doubt. Clear-cut, politicians should not be dispensing medical advice, deciding what's good or not good for your health. And I made a statement here. I think it's important to be informed. I think when you can, stand up for science and evidence-based facts in medicine. One of the reasons I debated long and hard about giving this talk, quite honestly, because there are politics involved, as you can tell. But on the other hand, it's been recommended for physicians to engage with groups of individuals like yourselves and to not remain silent. And so I have that.
Wonderful.